welcome to the annual mandatory training that must be offered by your clinic. The overall compliance training is 4 hours and 1 minute long. On top of that time, you may take 3 care and safety, PPE and barrier techniques, instrument reprocessing and sterilization monitoring, improving dental treatment water quality, and finally the overview of safety in radiology. You need to know the current CDC's recommendations and guidelines, understand and implement the OSHA standards, and finally protect patient information by following what HIPAA says for covered entities. So, let's talk a little about the rationale for infection control in the next few slides. They are a must before we go into understanding OSHA.
If it was not for smallpox, the second language in the great state of Texas today would not be Spanish but be Nahuatl. This was replaced by the germ theory in the 19th century after the discovery of microbes causing infection and disease.
It is just contamination, and can be taken care of by either disinfection, sterilization, or evacuation of the microbe.
It is important for clinicians and the OSHA. The risks can be classified into 4 descending ordinal categories such as high, moderate, low, and
Also,
uncommon. Many dentists spread this bloodborne pathogen to patients in multiple recorded clusters. Today we are more aware most of these protocols were based on bloodborne Universal precautions used regular, personal, additional, or transmission-based precautions based on the ADA and OSHA will craft guidelines of what one should do. Hollow bore instruments can carry liquids containing pathogens and have the highest surface areas which need. The last aspect to host immunity is non-specific factors, such as
the screening test only give an inkling of disease presence.
you should monitor for fever of 100.4 degrees Fahrenheit or more, cough.
That is if the body temperature is 100 degrees Fahrenheit or 37.8 degrees Celsius or higher. Common infectious diseases seen in dentistry could be of many origins. Form of TB was resistant to most conventional drugs and was later called multi-drug resistant TB or MDR-TB and was found. During initial infection, all infected people show presence of HBsAg.
According to my late professor in epidemiology from UAB, Dr. Cole, who said, it could be meaningless to explain the prevalence as a percentage. Today it is rare and seen mainly in the HIV seropositive population that are not responding to medication.
Droplets are normally heavy and greater than 5 microns in size. These are cleared to be marketed in the US and have a lot of literature on their compatibility with humans. Action on not concentrate on purchases of infection control products, but leave it to the lesser trained staff to make the purchases.
WA, rotavirus SA11, and poliovirus type 2. They must also have a claim on lipophilic ones such as herpes simplex 1 and 2,
Salmonella typhimurium, and 3. Staphylococcus aureus. The TB kill time of the disinfectant, and then wipe of the excess with a dry paper towel. For surgical scrub, a 4% CHG or a 1% iodine-based surgical scrub is required.
Some of the commonly overlooked items are as follows: beard covers, side shields for prescription glasses, orange. Constant and cumulative exposure to such high-energy visible light, or HEV light, can lead to macular degeneration leading to irreversible blindness much earlier in life.
Make inserts which go between the eyes and loops of the care provider. They make reusable and disposable products. They make disposable eye shields for patients as well.
Some of the accessories for a computer such as a mouse may need a barrier if they cannot be exposed to liquids.
We programmed this device to simulate practice in hygiene, restorative dentistry, prosthodontics, and other fields of dentistry where dental treatment water was used. Our informal Waterline Research Group's mascot, Nessie the nematode coined by Dr. Shannon Mills. Glycocalyx, macromolecules, and bacteria adhere. Green masses or dots are live microbes and red masses or dots are dead microbes.
Podaya and Cedarberg, study presented at the IADR.
Today, in dentistry, we see a lot of ambulant but immunocompromised patients or high-risk.
The last image is that of Blue Tab, a silver dihydrogenase.
It should be low in endotoxin content as well. It must be biocompatible.
Simulated standardized use for a period of 3 years. In the microbes from contaminating the treatment water or irrigant. Full error rate when compared to the gold standard are 2A agar. In a double-blinded study that we published looking at the effects of 7 irrigants with chemicals such as citric acid, many items in implantology need to be sterilized. All handpieces must be sterilized as they enter the oral cavity. What I have seen as a common non-compliance issue is in the practice of dental hygiene where practices while handling contaminated instruments, ultrasonic solutions, germicides or immersion sterilant. Each and every ultrasonic machine is constructed differently, and operations and maintenance are different. Take an aluminum foil and immerse partially and diagonally across the water bath with water chamber, then the temperature and pressure reach the parametric levels and maintained for the given sterilization time for the process to complete. Overloading of the chamber with instruments. Improper placement or stacking of instrument pouches. First video or part 1 we covered the basics of infection control. Here in part 2 of the series, we address the OSHA standards on employee safety. This program addresses the basics, the meat of what a dental team needs to know. That is, implementing about 5,000 employees died on the job, about 20% that who died were in the construction field. The deaths were due to falls, struck by an object, electrocuted or crushed by a heavy object for clinical use. Whenever you compress gas, the reduced volume must be put into a cylinder that can explode if mishandled, or, these equipment can be ordered through safety catalogs and must be installed as per safety and, if reusable devices are used, adequate reprocessing and decontamination of the devices must be attained after use.
Sharps, with engineered sharps protections, or adopt methods to control sharp injuries into the facility's exposure control plan. What is included as a blood-borne pathogen? BBP. The front desk staff may never be exposed to blood and OPIM if they don't help with clinical duties involving direct patient care or handling used instruments. There should be more than one category. Completely saturated with blood and must be classified as regulated waste. In image 3, although the cotton rolls within the circle are not saturated with blood, they are saturated with saliva and must be considered regulated waste as saliva is considered a potentially infectious material. All saturated waste must be disposed off in a red biohazard bag. The rest of the waste is not saturated and is considered non-regulated waste and can be disposed off as normal waste, in the trash can. Regarding soft waste, if we can squeeze out liquids such as blood or saliva of each of the ones involved, they will provide an initial report that needs to be shared with the employee and a copy in the health record. At 3 and 6 months after the initial chemicals, using appropriate PPE, how to store the chemicals, and what to do in the event of an exposure. In the GHS we will address labeling secondary
chemicals they work with and that they may be exposed to in the workplace and learn to use protective measures to reduce risks. All employees must be provided adequate information and training to handle the chemicals safely. All employees must understand the information on the chemical containers, the labels, the use of safety data sheets in the event of exposure or
Here is an example of using a secondary NFPA diamond-shaped label. Here the health hazard is 1 that is very low, the flammability is 3 that is just below the highest flammable level, on reactivity it is a 2 which shows that it could undergo a violent chemical change or reaction, and on the specific hazard white, it is a symbol that depicts a radiation danger. In the GHS labeling we must be concerned about 2 categories, namely the physical hazards and the chemical hazards. Physical hazards based on their outcomes are as follows. Corrosive nature. Flammability of chemical. Combustibility of liquids. Hazards of compressed gases. Explosion. That shows it is an irritant, corrosive, has health effects and is flammable. Please pause and read and familiarize yourself with the different sections of this GHS label, and is the overview of the Health Insurance Portability and Accountability Act of 1996, or called HIPAA, that is HIPAA. It is not to be pronounced or spelled as HIPAA, which is HIPPA. This overview also addresses the Texas House Bill 300 and its amendments, which is only applicable to practices in the state of Texas. If you are not a practice in Texas, you may skip the Texas House Bill 300 section. Scope. What is the scope of HIPAA? HIPAA protects patients' personal information, health information and financial information, healthcare, and specifically to those directly involved in providing care, protecting the electronic information within and outside the clinic, preventing identity theft and understanding the red flag rule. It's enter the information into the specific database fields. Most use the PDFs as attachments and non-searchable by query. Therefore, process non-standard information from one covered entity and convert it to a standard electronic format or data content or vice versa. The definition of a business associate is a person or entity performing certain activities or tasks involving you following. Who is covered? What information is protected? What safeguards to be in place for EHR and PHI? This rule mainly deals with security standards for the protection of important for the business owner. So go over this chapter multiple times. The general rule of the security standards risk analysis and risk management primarily addresses
that there is a low probability that the PHI has been compromised. Breach notification rule primarily addresses impermissible use or disclosure of PHI, where it compromises the security rule or the privacy rule. So use the free audit form either in your DCS compliance manual or going to my website and download for free the HIPAA audit form and use it while doing this walkthrough. If you are not licensed or practicing in Texas, you do not need to be trained in this module. Employees of covered entities, consumer or patient access to their PHI. A notice if the PHI is subject to electronic. Fill out the demographics of the patient. You can make this form fancy, but you don't need to. Enter the name of your clinic or organization. As to the other entities that you can share the information, and for what purpose. Educational institutions that handle the PHI of students, information technology companies that manage PHI, clinics that are personal information, they must disclose and notify the breach to all affected, whether a Texas resident or a resident of another state. This is if provider is not required to provide access to person's PHI that is accepted from access or to that information that may be denied under 45 CFR, Section 100.